So the symptoms are pretty much the same. What is unique about the face is that it has some unique structures such as eyes, nose, lips, ears. So a skin cancer that develops on the face is a much bigger concern for patients, and they're much more difficult to manage. Because, for example, if you have a skin lesion on your trunk or abdomen, you can easily excise that and stitch it together, and it doesn't have much of an impact on someone. But something involving an eyelid or your nose, you can't really do that, and it needs much more complex treatment. But essentially, the symptoms are very similar. The skin cancer often evolves as something that's changing on your skin, something that's new. So it might be a red patch or something that's not healing, something that's scaly. It might be a mole that started to change. So anything that's evolving, changing, you should have a high index of suspicion. The important thing about face is that, skin cancers are common in the face because the face is probably the most sun-exposed area of the body. So it is quite common to get skin cancers on the face. And what is important is to recognize them early, because if you recognize them earlier and treat them early, often you can avoid, some of the complex surgical treatments that might be required for more advanced skin cancers. The very early skin cancers can often be treated, with simple topical treatments or ablative treatments such as cryotherapy. There's, broadly speaking, 3 types of skin cancers. Basal cell carcinomas are the most common skin cancers, account for about 70% of all skin cancers. Then there's squamous cell carcinomas and melanomas, which are a bit more serious, but less common. So basal cell carcinomas often occur on places like nose, ears, and forehead, cheek, because they're very much related to sun exposure. And they might present as something red, something slightly raised, nodular, pearly lesion on anywhere on your face, something that's not healing. And they have some typical features which your doctor would often recognize. Squamous cells can often present as something that's scaly or rough, red, raised again, sometimes not healing. And often it means doing a little biopsy to confirm the diagnosis. But anything that's not healing or red, raised should raise some concern. It's something that should be checked. Melanoma can arise from a pre-existing pigmented mole, or it can be something which is completely new. And a lot of people will have come across this A, B, C, D, E method for recognizing or monitoring your moles. And so the things you want to look out for in a changing mole is, if you've got a pre-existing mole, is there any asymmetry in the mole? Are the borders irregular or are they jagged? C stands for color. Is the color uneven? Is it patchy? Is it multicolored? Are there pink areas within it? D stands for diameter, which is the size of the mole. So most melanomas will be about 6 millimeters or larger. So it doesn't tend to really be really small, but it can be. And E stands for evolution, so something that's changing over time. So essentially moles shouldn't be changing, they should be stable. If something is changing, it should arouse suspicion, it should be checked. The early skin cancers, there are now a lot of topical treatments that can be used, and that is often can be managed by dermatologists, and you can avoid surgical treatments, especially things that are recognized early. But by and large, skin cancers are treated surgically, and there's a range of surgical techniques. So the principles of managing skin cancer is to remove the skin cancer surgically and get clear margins, which means you are certain that you've removed the whole skin cancer, not left any behind. And then it's about reconstructing the defect. And in the face, obviously, scarring is a much bigger concern in the face. And also there's quite unique structures in the face. So you can't do big, wide excisions as you could do in other parts of the body. So you have to be pragmatic about it and minimize the amount of deformity or scarring associated with it. Mohs surgery is a new technique, but it's been around for a while, but it's much more available now. It's a method of excising mostly basal cell carcinomas and taking the minimum amount of tissue, but also confirming at the time of the excision that the skin cancer has been fully removed. And I would often work with a Mohs surgeon, for example, who would do the excision, and then they would come to me for a reconstruction. Reconstructive techniques, there's a whole range of techniques for reconstructing noses, lips, ears, and eyelids, for example, and these are all very much in the realm of plastic surgery, but the aim is to restore function and also get the best possible aesthetic outcome. We use things like local flaps, which means moving skin around, sometimes skin grafts. We place scars in areas where they're well hidden. And so there's a whole range of techniques to try and minimize the morbidity or side effects of skin cancer treatment in the face. Melanoma management and treatment has evolved a lot in recent years. So if you are unfortunate enough to get a melanoma, we'll often discuss sentinel lymph node biopsy, which is another surgical technique to check if there could be any spread to any lymph nodes or any trace in the lymph nodes associated with the melanoma. And that is a way of getting a bit more information about the melanoma and also determining which patients would benefit from more treatment. The things to look out for, and we're all looking at our faces the whole time, so we usually spot something that's changing. So anything that's changing in your face should arouse some concern. And the various types of skin cancers have their own typical features and presentations. So basal cell carcinomas will also often be slightly raised or pearly. They slowly grow and evolve over time. There may be slightly ulcerated or something that's not healing. Might be something that's scaly or rough on the surface of the skin, or a red patch that's not going away. Pigmented lesions, which are changing, as I've described already, look for the A, B, C, D, E, the asymmetry, the irregular border or jagged border, uneven color, variable color, increasing diameter, and something that's changing over time. These are the things to look out for. But certainly in the face, you should have a very low threshold for getting something checked, because if these things are caught early, then the treatment can be very, very simple. But as they become bigger and more extensive, then it can be much more difficult to manage them. Most skin cancers are actually treated surgically, and you'll find that plastic surgeons will often manage skin cancers in the face. The aim is to excise them with a clear margin and reconstruct the defect, causing the least possible scarring and minimizing any distortion or disfigurement. And there are other techniques like sentinel lymph node biopsy, which is used for melanoma. Survival compared to facial skin cancer and other areas of the body is essentially the same. There isn't any big difference. The risk attached to a skin cancer is very much determined by other features of it. So the size of it, the depth of invasion, how fast the cells are dividing. These are things we look at, but each skin cancer has specific criteria that we can use to give an estimate of the risk attached to it. But fortunately, most skin cancers that are detected early are actually low risk. But they can be quite serious and they can spread. The ones that are more serious are the melanoma or the squamous cell carcinomas, because they do have potential to travel and spread, whereas basal cell carcinoma almost never spread, but they do continue to grow and invade locally. So, it doesn't matter where you get the skin cancer, the risks are still fairly similar, but the consequences of a skin cancer in the face is much more distressing for patients than, say, for other parts of the body because of the potential for scarring and disfigurement.